Hi, I'm Dr. Sunanda Kane. I'm a professor of medicine at the Mayo Clinic in Rochester, Minnesota. And we're going to spend the next few minutes talking about an article that just came out in the medical literature, in the GI Journal, about a study that was published from the United Kingdom in regards to the risk of birth defects in women who have inflammatory bowel disease. So one of the most important questions that a woman has when she is thinking about having kids is, will her inflammatory bowel disease, whether it's Crohn's disease or ulcerative colitis, increase the risk for a birth defect in her baby? And there's been some studies that say perhaps yes, some studies that say no, and so there's been a little bit of conflicting data in the literature up until this point. There was a study that tried to put all the data together, and that was published a few years ago, and that suggested that if you had ulcerative colitis that there may be a higher risk for birth defects. But the study was somewhat flawed, and so we were back to square one. So this most recent study is looking at all the women with inflammatory bowel disease throughout the entire United Kingdom, studied from 1990 through 2010. And they were able to capture the children of those women and assess whether they had a birth defect or not, and also look back at the mother's health in terms of whether she was a smoker and her age at the time that she conceived, as well as the location which she lived in, and that would correlate with how much prenatal care she was getting, as well as any medications that she was taking for her inflammatory bowel disease during pregnancy. And that included the 5-ASA products, or what we call mesalamine, or steroids, or the other medicines azathioprine or 6-MP. And so what the study was able to do was collect 1,700 children born to moms with inflammatory bowel disease and compare them to close to 400,000 children born to mothers who didn't have inflammatory bowel disease. And it turns out that the birth defect rate was exactly the same. And when you looked at it broken down by disease, whether Crohn's or ulcerative colitis, there was no difference. When you looked at what medications that the mom may have been taking during her pregnancy or before her pregnancy, that it didn't matter whether she was taking any of the 5-ASAs, any steroids, or the azathioprine or 6-MP before she got pregnant, or during the first trimester, or even the second or third trimesters, there was still no increased rate for birth defects. And because birth defects in general is a very large catch-all category, that the authors were actually able to look for very specific birth defects and group them by cardiac, by other developmental, by musculoskeletal, to see if there were any trends in terms of the numbers of any one in particular grouping of birth defects. And again, they saw no signals there whatsoever. So the conclusions of the authors, based on the largest number of kids that have been studied in a population base, not just from one center that specializes in inflammatory bowel disease care, and looking at women who were taking a lot of different kinds of medicine and some not taking any medicine at all, and understanding that the risk for a birth defect in a mom who has inflammatory bowel disease is no higher than the background population.